take another package, antitussive and expectorant. That's for your breathing patient problem. With antitussive, you have the word dextromethorphan. Underline the word dextromethorphan. Antitussive means to suppress cough. Expectorant means it decreasing viscosity. That means it thickens your sputum for your patient. So when they're using the word antitussive and expectorant, antitussive means they're depressing the cough. And expectorant word is decreasing the viscosity. What is the meaning viscosity? The sputum will become more loosened, so it gets out easily, helping to take out your phlegm by decreasing viscosity. Now, some of your medication for your cough and decreasing viscosity are, it's called dextromethorphan. They don't give you name and they use the word dextromethorphan. Is you have Benylin, first one, Vicks formula you have, and you have Robitussin, the third one, in the second box. And what do you monitor when you're giving these medication? Drowsiness and nursing consideration. Antitussive means you monitor for cough and how frequently your patient is coughing. And dizziness, they can feel dizziness. So whenever you're giving cough medication and antitussive, expectorant, monitor for drowsiness and dizziness. Last line in third box, monitor for cough. Robitussin is third line you go, second box, expectorant. Give them with glass of water. That means increase fluid. And action, antitussive, suppress cough, and where it is suppressing in the brain medulla. Expectorant, decrease viscosity of bronchial secretion. Respiratory depression, hypotension, and photosensitivity. In the last line, avoid alcohol. So whenever you're giving this medication, that's important. I want you to move on the second page. It's called thiopaminophilin. Aminophilin are your bronchodilator. Very important, bronchodilator, side effect are nervousness. Underline the word tachycardia. Underline the word seizure. So they call nervousness. Very important, bronchodilator, go in the second line. Coffee, tea, cola. Don't give any more coffee. And monitor blood level. What is your theophylline level is 10 to 20. Second is breathing, is causing nervousness. Second line, tachycardia, palpitation. It's a short-acting beta antagonistic. And also, last line, monitor for blood pressure and pulse. Atrovent is also your medication for bronchodilator. What is the side effect are? Is nervousness, dry mouth, and palpitation. We are on the package with antitussive, and second page will go on. And Proventil. Proventil and breathing, now highlight the third box, beta antagonistic. Everyone should know. Sometimes they ask you what is bronchodilator are. Remember, they're called beta antagonistic. And short-acting beta antagonistic, monitor for toxicity. Anytime you're giving bronchodilator, remember, you do not give them coffee, cola, and any kinds of which is more stimulant. Everyone should know your theophylline level 10 to 20. And also before you give any bronchodilator, also check for cardiac. I want you to write down on the side cardiac. Why? Because it increases the pulse, tachycardia. So that's why if they already have tachycardia, you don't want to be giving or monitoring for toxicity. So memorize these names. Next page, you have bronchodilator and xanthine group bronchodilator. Acetylcysteine and mucomist. It loosens up the secretion and is called, underline the word, mucolytic in third box. And also I want you to add there, you are using this for Tylenol toxicity. Any patient come with Tylenol toxicity, you give them acetylcysteine and mucomist. What is mucomist is? I said highlight the word mucolytic. What is mucolytic? Loosen up the secretion and use nebulizer by mask face, by breathing treatment. Monitor for bronchospasm. Open vials, you can keep them in the fridge and used within 90 hours. And what does it cause is mucomist, bronchospasm. Anything bronchospasm is not good. Next, so everyone is okay. Acetylcysteine you're using for Tylenol toxicity. Number 2, Intel is cromolyn. We are on the package. It says there antitussive on 3rd page. And Intel is used for asthma patient. Go in the 3rd box. Underline the word mast cell stabilizer. Wherever you see the word mast cell stabilizer, that means prevent mast cell membrane for opening up on allergen, which is IgE. That means for asthma allergy. But remember one word, cromolyn is Intel asthma medication. IgE means allergy. It helps them. And used only for prevention of asthma attack, not acute treatment. It's not acute treatment, but you're using to treat asthma. Serventa. Next one, Servant, is a long-acting beta antagonistic meant to decrease on your patient for asthma. So it's a long-acting medication. Side effect is headache. Singular is another medication. It's also blocking the medication, reduce if hepatic damage is there. Now these are also some more bronchodilator. Intel, we all should know for asthma. Mucomist, loosen up the secretion. Serventa and Singular, you can give them. Now let's go on next page. We'll move on to the next page where you said antihistamine drugs are. What are antihistamine drugs are? Chlorotrimeton. Antihistamine, one of them is chlorotrimeton, dry up the mouth. All your antihistamine dry up the mouth. And second one, Benadryl, is also cause drowsiness. When you give and drowsiness, all your antihistamine cause drowsiness, dry mouth. And use sunscreen, underline that. And do not mix with alcohol. So Benadryl, photosensitivity is important, dry mouth. Phenergan is also antihistamine. You use also for cough and allergies, and it causes drowsiness, dry mouth, photosensitivity. You have Claritin, Zyrtec, Allergia, all they cause drowsiness. What is antihistamine is? Blocking the effect of histamine and receptor, and they are anticholinergic and antipruritic. You can also use for allergies and anticholinergic. Everyone is okay? Antihistamines are your chlorotrimeton, Benadryl, Claritin, Zyrtec, and Allergia. Very common side effect is drowsiness and dry mouth. Next page, you will go immune suppressive medication. You have cyclosporine. Cyclo or Sandimmune. I did it when I did this drug when we talked about renal transplant. Immune suppressive medication. What do you monitor? Nephrotoxicity and thrombocytopenia. And also take once a day, daily. Mix with whole milk, chocolate milk, or fruit juice, 3rd line. Then you skip and go in the last 2 lines. Prevent thrush. Cyclosporine can cause thrush. And what medication do you give them? Nystatin. In the last box, last 2 lines. Next, so where does it affect your immune suppressive medication? Underline the word production of T cells. T cells are for immune system, so underline that. Next page, you will go antiemetic medication for vomiting. What drug do we give for vomiting are Number one, Tygan. What does antiemetic can cause? Drowsiness, sleeping. And Tygan is given IM injection. Compazine, you can give another one. Drowsiness and photosensitivity. When you're giving compazine, what do you monitor? CBC and liver. Zofran, very good medication. When do we give them? Third box, you go in the last line. 30 minutes before chemotherapy. And what does it affect? Second box, liver enzyme, elevation of liver enzyme. So remember your compazine, Tygan, and Zofran. We are on the package of antitussive. In antitussive, you go on there. Then very important, you have Trosan, that's also, and it causes extrapyramidal symptom, shakiness. Reglan, very important, is causing EPS, is extrapyramidal symptom. Last box, you go monitor blood pressure. Take it before meals. Administer 30 minutes before chemotherapy. Antivert, next one can also use for dizziness, but also used for antiemetic. And what contraindicated, third box, with glaucoma patient. Dramamine when you're traveling, and that can be used. And Phenergan is also used for nausea and vomiting. So everyone, very important, your Reglan and Trosan cause EPS. Zofran and compazine and Tygan and your Dramamine and Phenergan, these are all your medication for antiemetic. Phenergan, you can also use for before traveling, 30 minutes before. Drowsiness, urinary retention, and dry mouth. Now, you have extra 2 pages I added on the end is here. I want you to make sure, just highlight the word. Is respiratory mucomist. Everyone should know. Mucomist is using antidote for Tylenol. It says in the last, you can use it with soft drink when using as antidote and add there for Tylenol. Aminophylline you are giving. And short-acting beta receptors is albuterol and Proventil. Long-acting beta antagonistic are Serventa. You can use steroids also. Epinephrine, if you go in the last line for allergies. And let's move to the next page. INH. What is INH? Your TB medication. Highlight that. When you're giving INH, it's a TB medication in the third box. Hepatotoxicity, liver, hyperglycemia. And also I want you to add there is B6. Why? Because they have in the last line, it says in the last box, tingling of extremity. So you can give them. Leukotriene modifier, you are accolade, singular, you're using as for treating asthma patient. Afrin is for nasal congestion. Don't use too long. And why? Go in the last box, it can cause rebound congestion. Afrin, you can buy it for nasal congestion. But if you use too much, it causes rebound congestion. Pass, next medication, TB medication. Then potassium iodide is expectorant. You're using for expectorant. Rifampin, I want you to write down TB medication. And what does it affect? Go in the third box, orange color of the body fluid, rifampin. And then you have, next one is also rifampin, then rifampicin, and monitor for liver. Next is your last medication is your theophylline, very important, which I already said in the last box. Avoid coffee and avoid use caution with ulcer patient and cardiac dysarrhythmia. 2 things is very important. Do not give in stimulant and do not use them if patient has cardiac problem. We have added a lot of extra thing here just so you guys don't miss a lot of things. And the next package I want to go over, antacids medication, is our aluminum hydroxide gel. What does it cause? Underline the word constipation. Everyone is okay? Antacid package. And underline the word aluminum hydroxide amphogel. I do talk a lot. We talked about it. And what do you monitor? So what are the antacids are? Aluminum, amphogel, calcium, aluminum hydroxide. I want you to monitor constipation. For amphogel, arrow there and monitor phosphate level. Make sure write down phosphate level. It lowered them. And third box, you go and skip 3 lines and go there, aluminum and magnesium antacid, therefore tetracycline, do not take with them. Okay, monitor sign of phosphate. Carefully with kidney dysfunction. So when you have kidney problem, be very careful with antacids. We already talked about do not give with tetracycline, do not give your other medication antacids. Milk of magnesium. It is laxative, but they also use as antacid. What do you monitor for diarrhea and vomiting? Maalox is also has laxative. So milk of mag and Maalox, they're using both for antacid as well as laxative. And when you're giving Maalox, encourage fluid. Now, next page, if you guys will move, is anti-diarrhea medication. What is diarrhea medication are? Pepto-Bismol, Kaopectate. What does it cause? Constipation, because you're giving. And what do you increase when you're giving constipation? Encourage fluid. And also go in the last line. Kaopectate and Pepto-Bismol, cautiously if already taking aspirin in the last 2 lines. So what are these are? These are anti-diarrhea medication when patient has diarrhea. Second one, you go in Lometil. Lometil is narcotic. It causes sedation, underline the word paralytic ileus. And go in the last line, decrease peristalsis in the third box. Imodium. Imodium is also your medication you're giving for diarrhea. So Lometil, Imodium, and Paragoric. All are these your diarrhea medication monitor for constipation and increased fluid. So those are important. Next page, we'll move on. Carafate. Carafate is given for ulcer patient. And take medication. It also causes constipation. Indication, ulcer, highlight, so you don't have to add it. It's a ulcer medication. Monitor for constipation. Next page, we already talked about calcium, Oscal. We did already. We talked about magnesium, potassium, and sodium chloride. So we did. Now I want you to move on some more laxative and stool softener. Cascara. Cascara is cause abdominal cramping and lowering potassium and calcium. Third line, give them with water. Dulcolax is causing cramping. It works faster. Go in the third box within 6 to 12 hours. So when you're giving Dulcolax, it works in 6 to 12. Fast, very fast stool softener. Mineral oil. When you're giving oil, then you go in the third line, in the last 2 lines, may cause prolonged use fat-soluble vitamin malabsorption because it's oil and they cannot absorb the fat. And what is it, mineral oil? In the third line on the top, it's more like a lubricant. Dulcolax is stimulant, so make sure you know that. Colase is called stool softener. And it takes about, in the third box, 1 to 3 days to work. So remember, few things is important. Metamucil, when you are giving, and it's, what is it called? It is a laxative, bulk forming laxative. Remember, write down the word bulk forming laxative. What do you increase here? Water. Give 1 glass of water. Increase it. Monitor for distension. Then the last one, you have colite, and large volume, allow time to consume. It is lot volatile, is they're giving. Everyone should know your laxative. These are your laxatives. Next is page you will go on ulcer medication. Is called, first is H2 antagonistic. Is called cimetidine. I want you to write down the ending word tidine. Tidine. Whenever you see tidine, these are your ulcer medication is H2 antagonistic. Where it says the word Tagamet, write down the word given HS. So write down Tagamet HS in the box. You give Tagamet nighttime. And what does the Tagamet cause? In the second box, confusion, especially your Tagamet. So all your tidine, like Tagamet, Zantac, Carafate, these are all your tidine. And you can give them, and what are you monitoring here? Diarrhea, second word, confusion, and last one, dysarrhythmia. In the third box, avoid antacid within 1 hour of your tidine. Don't give antacid with them. And so next box, you have omeprazole. Omeprazole or prazole. I want you to write down, another word is prazole. So tidine and prazole are ulcer medication. Tidine and prazole. And what are those ulcer medication are? Omeprazole, lansoprazole, Pravacid, Prilosec. When you are giving, is monitor for dizziness and diarrhea. I want you to add in prazole 2 medication more, very important for anthrax. Nexium. Nexium, when they give, that's also prazole, and Protonix. Protonix, that's also your prazole. So everyone is okay. Ending word tidine and prazole are your stomach medication for ulcer. And do not crush some of your medication. Then prostaglandin is cytotec, and cytotec can cause diarrhea. Now next is underneath you have B12. You all know B12 you are giving IM for pernicious anemia. Folic acid, when you are giving folic acid, we did already, cause bronchospasm, just highlight that. So everyone is okay. Ulcer medication are your tidine and your prazole. Those 2 are your medication for your ulcer. Next page, antihistamine, which we already talked about it. It's duplicate. You don't need that. We have already done. Antiemetic, we already talked about it, Reglan and this. But the last page, I added some more medication for your gallbladder and pancreas disorder, and some of those medication are for your, like Gamizar. That is your medication for if the patient has pancreatic ulcer, pancreatic cancer, and monitor CBC. Lactulose, where do we use lactulose? We did it, and which patient? For hepatic encephalopathy in the second box. Liver cirrhosis. Aldactone is your diuretic. Demerol is for pain. Probentin we already talked about. Vasopressin. What is a vasopressin? Is antidiuretic. Where do we use vasopressin? Write down on the side. Diabetes insipidus and GI bleeding, your patient. Neomycin is antibiotic. And what do you monitor when you're giving is neomycin, ototoxicity and nephrotoxicity. Antacids we talked about, anti-tagamet you have at the end. So this is your GI medication. Last package, important and very important, some of your antibiotic. And I like you to highlight some of the wording on page number it says genitourinary system. Furadentine. Furadentine is your infection medication. And what do you monitor when you're giving furadentine is asthma, any breathing problem, and diarrhea. Number 2 drug is pyridium. What is pyridium is, underline the word, is urinary tract analgesic. They are called as urinary tract analgesic, okay? Anticholinergic medication are, so pyridium you are giving when patient has burning sensation. It's called urinary tract analgesic. Anticholinergic medication are for UTI patient. Ditropan, you can give them, and probenthine. And what do you monitor for them? Underline the word urinary tract infection. Viagra is your medication for erection in the male, and we said do not give them with nitrates. And when you have prostate enlargement, you are using Proscar. Underline that word. Proscar is you're using the medication. And you go in the third box, BPH. Proscar you're using, and Propecia you're using for hair loss. What are you using? Propecia. So urinary medication, these are some of medication you're looking for UTI patient. Anticholinergic, second page, anticholinergic is probenthine you're giving. And what do you monitor is gastric mortality. And atropine sulfate, that also anticholinergic medication are. Now, next page, you will move on, is antifungal medication. That is important. What is antifungal? When you have fungus infection, fusinzone, F-U-N-G-I-Z-O-N-E. What do you monitor when you are giving fungal medication? Third line, hypokalemia, low potassium, and skin irritation, IV infiltrate. So when you are giving a funizole, so if you have fungal infection, your patient, one of these medication can be used. Second medication you will go is nystatin when you have thrush in the mouth, and that can be used for mouth infection. Duflacan comes in exam a lot, third one, and that's your fungus medication. And what do you monitor for your patient are diarrhea and liver enzymes. So these are your fungal medication. These are all your treating infection. So make sure you know what are the fungal medication, what is your antibiotics are. Next page, we already talked about INH, and very important with INH, second line, peripheral neuritis, make sure write down B6, and hepatitis, check liver. Ethambutol is when you're giving third line visual, eyes. Rifampin, I said, it changes the urine color. Streptomycin, you can give IM, and check is audiogram, hearing. So INH, ethambutol, rifampin, and streptomycin, these are TB drug, okay? So we talked about them, so review that. Viral medication, antiviral medication are when you have herpes, you have cytomegalovirus virus. I want you to write down which is your viral infection are. Write down on the top like herpes patients are. And herpes zosters you're treating them. And remember cytomegalovirus virus, cytomegalovirus virus, and that also you're treating viral medication. Respiratory syncytial virus, I did in the peds, you're treating them. Number 1 is Zovirax. Zovirax is your medication are in your patient with Zovirax, and what do you monitor when you're giving Zovirax? Seizure and diarrhea. Last box, you're treating herpes patient and encourage fluid. What do you monitor? Liver and renal. Second medication, very important, ribavirin. Write down there for respiratory syncytial virus. How do you give them? It says in the third box, severe respiratory tract infection in children. I did in the peds, ribavirin. And how do you give them? Third line, by breathing treatment, aerosol. And also contraindicated in pregnant person. Remember, we talked about and prevent their eyes. And if they're using contact lenses, they cannot use that, and they have to wear the goggles. AZT, zutavidine. Why do we use it? Underlined HIV infection that we talked about in OB. Then you have zaltabine, ulcer, when they have oral ulcer, side effect. All your viral medication can use it for viral infection. And Videx, Fimavir, and Cytovine. Last one, I want you to highlight regular eye exam in the third line when you're giving. I want you to write down common side effect and what is your viral medication. Ending word is called VIR. V-I-R. When you see VIR is what? Your medication for viral. What are the common side effects? I want you to write down. Cause is number one, CNS depression, such as confusion. It causes confusion, it causes tremor for your patient, and seizure. Very important. Any of these side effect with your viral medication. Number two is proteinuria. That means check the kidney, proteinuria. Number three, very important, this and the other one is called diarrhea. So VIR medication causing diarrhea. And number four, vaginitis, infection in vaginal area. So everyone, common side effect, write down ending word VIR. Some of these your medication are, and cytovine, I told you to highlight the word eyes. Make sure you are checking eyes. And you're checking kidney, CBC, and renal. Next page, antibiotic, penicillin. When you're giving penicillin, check allergy. And underline the word allergic reaction, nausea and vomiting and diarrhea. I want you to go in the last line and underline the word is cephalosporin. All your cephalosporin has penicillin. If the doctor has ordered cephalosporin, do not give them, check for allergies. Check for hypersensitivity to other drugs, especially cephalosporin. I want you to go on the top. Give 1 to 2 hours AC or 2 to 3 PC. And what do you monitor? Foul-smelling stool and the tongue. What is the means tongue? Is that white patches can cause them. Second antibiotic, you have sulfonamides and gantacin. Whenever you are giving gantacin, is underline the word allergies or rashes. Third box, I want you to increase fluid. And last line in third box, when you're giving sulfa, avoid vitamin C because acidified the urine. Azulfadine is anti-inflammatory, but also antibiotic. Increase fluid in the third box and make sure write down anti-inflammatory. And skin rashes. Trimethorphan, Bactrim, and Septra. It causes rashes. And go do culture before you give, never give IM. Increase fluid. Bactrim, Septra, increase fluid. Very important, I'm going on tetracycline. When you're giving tetracycline, give them with the meals. And also GI symptom. Check bowel preparation. Avoid sun exposure, very important. Avoid sun, and also in the second box, dental discoloration. So do not give tetracycline to pregnant person and children. And sensitivity, and we said earlier, do not take it with milk and antacid. Vibramycin, causing photosensitivity. and causing tongue or monilla fungal infection. All your antibiotic, monitor for that. Aminoglucosides, we always talk about it. What is two side effects are? Ototoxicity and nephrotoxicity. And what do you check for them are in the third box, second line, peak and trough. What is peak? After injection. Trough means before injection. Audiogram, hearing test. Neomycin sulfate, ophthalmic, you're using in eye. Everyone should know your penicillin, gantacin, Septra, and also aminoglucoside. Next page on antibiotic, you must know Cipro. Cipro is next page. Do not give children under 18 years of age and give fluid. Zithromax and erythromycin you are giving for lungs infection, pneumonia, write down. And also check for renal. Your cephalosporin are, they are all allergies with penicillin, like Ansef, Caflex, Rocephin, and these. You cannot give them penicillin. We already talked about vancomycin. In vancomycin, you go in the third box, is red man syndrome, and that means the blood pressure and flushing face. And also you have topical on the skin, bacitracin ointment you're applying, that's antibiotic. Neosporin cream, betadine, silverdine cream, tinactin, mycostatin, fungal infection, and monitor all your skin around the allergies. Now in the next page, if you guys will know, is second box is your attention deficit medication are. You guys don't have in the 2 or 3 packages there? In the back on this package, there are 2 more pages, you're missing that? Okay, so I will do some other time. But I gave you guys, let me show you another package on your skin medication. Everyone has those 2 packages, integumentary, and you have chemotherapy and your eyes. I want to show you, very important is your integumentary, is Accutane. Everyone should know, for acne patient you use Accutane. What do you cut down? In the third box is integumentary. If you don't have, you can come and get the package here, but make sure you guys take those packages, and I'm just going to show you in integumentary, Accutane is important, cut down vitamin A and protect them from sun. And also check the cholesterol, and not to get pregnant when you are giving this medication. Quell, third one is Quell. You are using for patient Quell for also for your skin diseases when you have scabies or head lice and cause local irritation. Now I want you to, underneath you will see betadine. Betadine stain the skin in the last line. And betadine is not good to open and use it on the skin. Salicylic acid. Where did I say salicylic acid? Psoriasis patient. When you have skin problem, psoriasis, you can use it. External. Lamisil is fungal medication. Tetracycline is same, we already talked about, antibacterial, you can use it. Tinactin is your fungal medication, applying on the skin, antifungal. Next page, Zovirax, we already talked about your antiviral medication. And when you're giving Zovirax in the last box, hydration, when you're giving IV, make sure you check the skin, but you're giving for antiviral. Alpha Carry, you're applying on the skin, and it causes local irritation. Boros solution is used for patient for cleaning. And in the last line, no occlusive dressing. I covered that when we did in your patient with skin disorder. So where it says Boros solution is very important, don't cover occlusive dressing. Benadryl, itching. You can use Benadryl medication, it blocks histamine. Side effect, itching, and drowsiness. Atarax and Viscril you are giving for allergy. That means when your patient has itching problem. Now, hibacin, that's also for your antimicrobial. Coal tar, I wanted to highlight that, for psoriasis patient. So psoriasis patients, the skin is very thick and you can use them. Now, those are, and last one, very important fungal medication, which is Grucifin. And you give them for antifungal, avoid exposure on sunlight, and give them with meal. So everyone, we did this with skin chapter, but I'm giving those who are missing and those who have not done. Then I gave you a package I did with the patient with cancer. So make sure you guys have cancer medication, and you can go over some of your cancer medication. And the last one, I gave you eye medication. And very important in eye medication are second page and third page, meiotic medication. What is your meiotic medication you give them? Glaucoma patients, right? And what is meiotic word is for they are constricting the eye and you're using meiotic drugs. What is meiotic medications are? Last one, but I definitely want people who are taking exam have all these packages and review. It's not that easy, but just do your best. Is number one, you have pilocarpine. And what is meiotic word is it constricts the eye. So which patient are you giving for glaucoma? And carbachol, you have second line, and it produces meiosis during surgery, carbachol. Well, what are the other medication I want you to write down for glaucoma are, is pilocarpine 1. What are the other medication? I want you to add there mannitol. Mannitol you are giving IV. And what do you monitor? Potassium. Diamox you are giving for your patient for glaucoma and also monitor potassium. Pilocarpine, mannitol, and diamox. Everyone is okay? And the second last page, mydriatics. What is your mydriatics are? Is atropine, eye drops. And what does it cause? Photophobia. You do not use this for glaucoma patient. There is dilating. Cyclogel. What is cyclogel are? Also not used with glaucoma patient, they are mydriatics, but cyclogel are given for dilating the eyes. And when you are using that is, remember, applying the pressure. In nursing consideration, you have in nursing consideration, apply the pressure for 1 minute to prevent systemic effect. So some of your eye medication, cancer medication, we have talked about when we did in chapters, I added those, and eye medication, a lot of time we have talked about on their skin. So and there is one more package you should have, and that is for your memorizing. This one is good. It says ending word. So if you will see at the last page and some of the last pages, you guys have the lab here. What is a normal, your level, like lithium, magnesium sulfate, dilantin, theophylline, theodore. It's the last page. And angiotensin, it says antidiuretic, antilipemic. And we already talked about, but it tells you the ending word. And on this page, you guys have the lab. So it will be good. On the first page also, it tells you what are the wordings are there to memorize that. So we gave almost likes and package. And I gave those who are not going for your test, I gave 2 set of questions. And do that question. Whenever you come back, check the answer. So pharmacology is very important, and we covered a lot of packages. And I know it's not easy listening one time. At least having package, going through the packages, your antibiotic is important, viral medication, eye drops are important, and your cardiac medication we did, anti-anxiety package we have done, insulin we have done. So I want you to go over. Anytime you need help, you can come back and check with me, all right? and do the questions. So I will stop here. Any pages you are missing, you come and get it, and just study and do good on your drug packages, all right?